Hello guys, Assalamu alaikum. Welcome to Revised Pathology. Today, as per the promise, I'm here with the topic of dissecting aneurysms. Let's see what is dissecting aneurysm. So, dissecting aneurysm is usually applied on dissecting hematomas, okay, in which the blood enters into the vessel wall, which is dissected. So, please understand it very well. It is applied on those hematomas in which the blood enters into the dissected part of the vessel. Okay, next, its common site is aorta, and the pathogenesis is depending upon two, that is hypertensive and non-hypertensive cases. Hypertension, hypertension, normal BP increases, and then dissecting aneurysm can be caused. And after that is non-hypertensive cases. For example, there is pregnancy and iatrogenic trauma, any sort of trauma, right? Or if you come to iatrogenic trauma, it's like trauma that is being induced. For example, during the time of surgery, any sort of hematoma is being created in the chest cavity, and that creates an aneurysm, or that can create a dissected aneurysm. Now let's come to the types. So guys, coming to the types, there is two types. There is Debicki's classification and Stafford's classification. So in Debicki's classification, there are three types, that is type 1, type 2, and type 3. Type 1 is the intimal tear happens at the ascending aorta. Where does it happen? In the ascending aorta. Type 2 is being limited to the ascending aorta. Fine. Whereas type 3, it occurs in the descending aorta. Now we will come to the Stafford's classification. So guys, coming to the Stafford classification, it is two types: proximal dissection and distal dissection. Or else the proximal dissection is called as type A, and the dissection is called as type B. Coming to the effects, there can be rupture, ischemia, and any cardiac diseases occur. So that's all for today. Stay subscribed to my YouTube channel Revised Pathology, like, share, and comment on my video. Till then, Allah Hafiz and take care of your health. Allah Hafiz.